Julian. COVID has had a major impact on hospitals and its staffing. And there's also the risk of violence, like what we saw this week in Tulsa when 4 people, including 2 doctors, were killed. We also saw it here in 2018 at Mercy Hospital when 4 people were killed. Jean Blake, the chief nursing officer at Sinai Hospital, joining us now to talk about the impact on patient care. First of all, condolences to your colleagues as to what happened in Tulsa. And I'm sure that was very frightening for you to hear.
It is. At Mount Sinai, we see violence every day. We see trauma victims every day, penetrating trauma. But to see it and hear it happening to our own, to doctors who go to work to help people every day, a receptionist and a patient, it's horrendous. And what happened in Texas with the children and the teacher, the 2 teachers that stood in the way of the gunfire and sacrificed their own lives for children. It's very impactful. On top of seeing other people be hurt, now it's coming to our own profession. And I'm certainly hoping that it doesn't cause people to turn away from the medical profession because we really need them today.
How vulnerable does that make you feel? And how does it affect your patient care?
You have to put it aside. We have a very strong mission at Mount Sinai and most other hospitals to take care of our patients. It's our mission, it's our vision. And, we are at risk. We are hurt. Our nurses, first responders, physicians, kicked, bitten, hit, punched. It's part of the daily routine with patients, but we accept it as part of the job because we live the mission. And we're here to take care of people. It's just horrible to think that we have to put ourselves at risk to take care of others, but that's what we do every day.
And has that affected your staffing? Are people leaving the job?
Yes, there are definitely, since the pandemic, we have seen a big exodus out of the nursing profession for people who just cannot tolerate they don't have the inner strength themselves to face some of this constant turmoil or constant death. I mean, during the peak of COVID, we were losing patients every day. And sometimes the nurses were the only contact with humanity that the patients had, and they were at their bedsides as they passed. And that can take a big emotional toll on nurses over time.
Other than expertise, let's talk about the difference between nurses and doctors and how you may be a little bit more intimate with the patients.
That's very true. It may be a little bit different in the emergency room because they don't typically stay too long unless they're boarding and waiting for a bed. But on the floors, and particularly in the COVID surges, we would have patients for weeks or months, and you get very connected to them. And sometimes you're their only contact of humanity. Nurses were very creative. They would fill gloves with warm water and put it on patients' hands to make them simulate the feel of a human touch if they couldn't be at the bedside. But knowing that you were that conduit for kindness and compassion and empathy, it makes the job all the more important, but also at the same time all the more difficult.
Jean, do you see where COVID is subsiding a bit for you guys, giving you a breather a little bit at all?
We are getting a little breather. We still have a few cases, and that is going to continue, I think, for a long time to come. But we are not in a surge, and we are very grateful for that.
We have had 1 case of monkeypox discovered now in Illinois. What do you think about that? Does that bring fear? Well, actually, I'm corrected. There have been 2 cases here in Illinois. And what are your feelings on that?
We will look at, if we get monkeypox, we will look at monkeypox the same way we look at COVID, or we looked at SARS, or any other type of endemic disease. We will face it, we will figure it out, and we will work together as a team with the physicians and the nurses to take the best care of the patients that we can.
And quickly, Jean, how do you maintain sanity in your home after doing something like this all the time?
Well, I've been doing it a very long time, and my family is extremely accepting of the job that I do. They feel I'm ready for retirement, I will tell you that, but they understand that this is what I do, and this is what I give. And I try to spend my time with my grandchildren and my kids in my off hours, because that's the break, the relief, and it's the kindness and the love that you get back from your family.
Jean, thank you for your service and all of the other nurses who I always call the angels of the hospitals. Be safe,
We
be
are the
well.
angels, but we work together as a team, and I appreciate this. Thank you very much for asking.
We appreciate you. Take care of yourself. Be safe, be well.
Thank you. Take care.
You can watch the WGN Films Medicine is Sick special tomorrow evening.